Hello, Dream Team. Welcome back to the AMP podcast, episode 6. And I'm joined by Jacob.
Hi.
Good to have you.
Always good to have you.
So today we're going to be discussing all things hyperbaric treatments.
Yes,
We've got lots to tuck into. Plenty of information today for the geeks. Lots of interesting stuff around the brain and the body and its amazing ability to heal itself, and some of the insights that some of the latest science around hyperbaric treatments have sort of brought to that field, if you like, in terms of boosting our body's natural ability to heal ourselves. Let's start a little bit with you, and a bit about your background and how you got to the point where you are now, what you're doing.
Very broad question. Good. So if we kind of briefly go through the short history of what happened to me in the last couple of years, I've moved to the UK 7 years ago. My background is actually Chinese medicine. So I've studied 4.5 years of Chinese medicine with a lot of interest in pain. That was kind of my kick, to understand pain education, what's going on there. I had a small clinic back home, and then when I moved to the UK, had a small clinic here, worked in a couple of things, but didn't find myself as much. I started working with pure sports medicine. I'm familiar with them, they're quite big. And that set me up on a very interesting course of learning more, understanding what's going on. It also introduced me to a lot of clinicians. So you get like from none to 100 or something clinicians with you. So the more I dived in, the more I had conversations with those people, I understand that I don't understand much. I need to understand more. And that led me to, I'm doing my physiotherapy studies now, on second year almost. So for me, I was like, I need to study more. Part of my clinical approach was breathing work. That led me to understanding of what's hyperoxic, like more oxygen or less oxygen, the things that we can play with our breathing, or as a means to treat someone's pain or treat someone's inability to breathe, asthma, or even performance for athletes. And that just led me to a very interesting article about hyperbaric medicine. It's like, because it's part of the hyperoxic kind of approach, you give more oxygen to the patient in the willing, the idea of getting their tissue oxygenated. And the article I've read was about PTSD. It's a very fascinating thing. I was like, in my head, no link, what's the connection? And it brought it really close to my heart because my brother and a good friend of mine suffered from PTSD in different levels, but they're all okay now. And when I read the article, I was like, this is interesting. This is a brain issue that manifests itself in mental health, but it's a brain issue. And yeah, that was kind of a turning point for me for hyperbaric. Till now. And
So you've worked as a physio for how long now?
I worked with Pure.
Yeah.
I've been working with them for 4.5 years or so.
Okay, so you've seen a really wide range of different types of patients.
Mostly MSK. So the world that I'm in at the moment, is very MSK oriented. So I see injuries, I see a lot of pain, knees, shoulders, back. Those are the ones that I see the most.
So musculoskeletal,
musculoskeletal, exactly, MSK. That's what I see the most. But the old patient that comes in with a very complicated situation, so they will come in with back pain, but the underlying issue is emotional or stress or workload, and they will have migraines all of a sudden. They will have autoimmune disorders. So it's not the back pain itself that is really interesting here, or the one that you want as a clinician to treat. Well, obviously you want to do this because that's the symptom, but you want to go to the deeper stuff and understand, wait a second, why do you have this? Why do you have constant migraines? How's your sleeping? How's your diet? Those things put you in a bigger perspective. It's a holistic approach more than anything else. And the breathing work is just one element out of those things. It just leads you to understanding how the person moves, how the person breathes. And essentially, that's the deeper stuff that I want to do with hyperbaric stuff. It's the holistic approach.
That leads us on very nicely.
Yeah.
We've mentioned it a few times already. I mentioned it in the intro. We've talked about hyperbaric. We've talked about hyperoxygenated systems within the body. For those of listeners who have not come across a hyperbaric chamber before, What is it?
Well, I've heard so many things, and now recently with the father and the son that went lost in the search for the Titanic, it looks like a submarine. It's a chamber made of iron, so it's a solid chamber. You go inside, and it's being pressurized by generators, and you breathe air through a mask. So you put a mask on, you breathe close to 100% oxygen, and you don't feel much inside, basically, besides popping your ears every couple of seconds when you go to the depth you're supposed to go to. You don't feel much. And because of the high-end chamber that we have, so basically you can watch TV, you have Netflix, so it's a very chilled out, relaxed, non-invasive, simple approach to a more complicated situation that you might be dealing with. It puts you in a position that you are actively, you don't need to do much, but we recommend, obviously, part of the programs we'll discuss later on, is we'll encourage you to act on some of our recommendations, diet-wise, sports-wise, those things. But the chamber itself, super relaxed. It's a high-tech. You can watch TV, you can read a book, you can snooze, whatever you want. So it's really nice.
That's very nice. I'm in already.
Join in.
So you mentioned a couple of things there. One was pressure.
Yeah.
And then the other one was oxygen. So those are the conditions that you're essentially under within the chamber that you are not normally under. What are the differences? What are the pressures? What are the oxygen levels? Do they vary? Those kind of things.
Yeah.
How does that change?
Very good question. We know for a fact that out there's oxygen therapy by itself. Oxygen delivering to the tissue, either for breathing through a mask or being in a chamber that is only oxygen. The pressure is the element that is the key component in this whole idea. Hyperbaric medicine itself is not a new concept by all means. It's 400 years old, the concept. Clinically, further down. But as a concept, it's 400 years old. So from the 16th century, they discovered the whole idea of you being compressed into a chamber and can treat things. It's worth mentioning that hyperbaric medicine is the kind of the daughter medicine from diving medicine, which is well established. So
that's what I was actually just thinking as you were talking there, to be honest.
Yeah.
Sorry to interrupt, but having looked at some of the research around being submerged underwater,
yeah,
with some of the findings being attributed to the health benefits that they found, being attributed to actually the increased level of pressure that the water is applying on the body, not just the actual water submersion itself,
yeah,
and then combined with breathing practices, whereby, interestingly, the mechanism of benefit was described as getting more oxygen into the system by using a particular breathing method. So this is like that same theory or train of thought, but on steroids here. We're talking.
Yeah, in a good way. You've touched the right thing. So we have two things. One, we cannot dive people all the time. We don't have facilities, and the depth you want to go to is more than 10 meters approximately, and that's where most studies are, around 10 meters, which is an equivalent of 2 atmospheres. Absolute. That's where you put yourself in the chamber. So if we don't want to dive you into water, and we know that an ocean close by, that is exactly the same thing. Diving medicine was treating diving accidents. What's the name? Oh, forgot. Diving accidents and in-depth sickness, those kind of things. So if you surface too fast, you need to go into a chamber, then decompress.
Is that like the bends?
The bends, exactly. Do you know why they call the bends, by the way? It's a side note.
Go on.
People that suffer from the bend century ago, they used to bend in agony because the joints were so inflamed and painful that they will bend, it will go very kind of low, and then that's why it's called the bends. It's a very painful condition, by the way. I'm not recommending anyone experimenting with themselves going into a dive and ascending fast. So that's the main concept. Putting a caveat to this, it's a very, very safe treatment modality. So we are not looking at something that is risky. So it's not like diving that puts you in a risk of anything. You're actually very safe. It's a very controlled environment. There's a computer that controls everything. So I have a program that I follow. So it's very, very kind of. So that's exactly what we touch base. So it's a diving medicine going into hyperbaric medicine. It's more established nowadays in the world. There's used facilities in Israel, which I'm proud to say that I visited. They treat 300 people a day with a waiting list of 20,000 people. this is how big that is. The US is also going through that kind of process. The FDA approved 15 conditions so far that the hyperbaric medicine can and will treat. Among them is head injuries, long COVID, fibromyalgia, those kind of things. The FDA is slightly behind other countries like China, Russia, and the EU that have up to 70 conditions. This will be appropriate for them to treat, which it's a very fascinating field because it's growing. They understand the concept, and the concept can be applied to a lot of conditions, diseases, conditions, whatever. And circling back to what you started saying, the whole concept is basically putting you inside that chamber. You breathe that oxygen, and we deliver that oxygen to the tissue that is either deprived or ischemic or sick, for that matter. It could be a varying of things that are happening to that tissue for not getting oxygen enough. And by putting that pressure, we're increasing the likelihood of the oxygen going to those tissues. It's not only you breathing that oxygen, but we know from physics, gas laws, that once you increase the amount of pressure on that blood vessel or your body, then that oxygen will be diffused through the plasma. That puts you in a greater option to get the tissue being oxygenated. So that's really a key component in the therapy.
And so then adding into the additional atmospheric pressure, you're then adding in higher concentrations of oxygen that are being breathed in. Does that just further exacerbate the mechanisms you're describing there?
So we have layers when we are talking about hyperbaric medicine. So the easiest thing it's like an onion. Let's break off the first layer. The easiest way to think about this is that oxygen. There's a tissue somewhere in your body. It could be your muscle, it could be your heart, it could be your lungs, it could be your brain, that is deprived of oxygen for some reason. Okay, either an injury, or you got sick, or it's ischemic, so it's occluded, it's closed, clogged for some reason. And we just deliver the oxygen. That's the simplest way to look at this whole thing. And if you want to break off another layer of that onion, then once we put oxygen in that system, there's a cascade of chemical, physiological things that are happening. The body is like, okay, something's happening now. Let's regenerate blood vessels. Let's put the immune system on kind of hold. Inflammation cascade is being on hold or being reduced. So that's kind of another layer. And then the other layers are way too deep in the chemistry stuff or physiology. But we are looking at reducing the inflammation in that area. That's the most important thing. Generating stem cells, so it's cells that can create anything. So neuronal blood vessels, those kind of things will be a key component in that recovery. Another layer. But if you want to go deeper, that will be a completely different conversation.
Well, we can maybe double back and talk about some of the more physiological details. I suppose what I'm interested in also is what are you able to treat? Because you mentioned already there's a difference between how different countries are viewing and accepting what's treatable through this type of therapy. And you mentioned, I think, 70 was a sort of list of things potentially. We don't have to necessarily go through each and every single one, but just generally in terms of the application that you see, you offer different programs.
Yeah.
And the first of that is recovery. Do you want to talk a little bit about how it helps with recovery? And
sure.
Because I think for our listeners, obviously there will be people out there who've got some of the other bits that you're able to treat. But I think for most people, from a performance point of view, this discussion is interesting because it showcases how our brain and our bodies are able to adapt to the stimulus that we give them. And I think a lot of people are interested in, can I hack into that physiology? Can I, not shortcut necessarily, but optimize what I'm doing in order to get the most back for the amount of time that I'm putting into my health, well-being, training, whatever it might be.
Good. So just a small note of what you said about the 70 or 50. The main concept, the common component in this is basically getting oxygen and energy to a tissue that is being deprived of that. And that can fall into all the brackets you can imagine. It could be a disease, it could be an injury, it could be an accident. So it makes that 70 kind of number very kind of odd, because anything that can happen to you with that tissue, could be the muscle, could be your heart, or any other organ, then once we give it the oxygen, then we might save it. It might not die. So if it's dysfunctional, so it's not dead yet, we might save it. And there's a cascade of things that might happen to that cell, to that area, that makes it again functional. If we make you functional, then we save that tissue, we save that functionality of that area, i.e. the brain. That's the key kind of thing. And then once we are talking about this, we know that recovery-wise, we have two options. One would be an athlete that had an injury and wants to go back to training, competing, whatever he does, either as a hobby or as a professional. And once we are on that very, very kind of tense, high performance periodization, when you're picking, when you go all the way up to that very kind of few weeks that you pick up all the training, that time is that likelihood of you getting injured. We want to put you in the chamber to recover you faster. We want to put more oxygen in your tissues. We want to work on your mitochondria to get more functionality, and basically want to put you in the position that you're better once you go to the competition. Once you're out of the competition, then maybe we'll kind of reassess and we think maybe now you need slightly less recovery, but the training regime is so loose that you can recover by yourself. That's one kind of population that will benefit from this. And they're not injured, basically. They're healthy. They want to just get an edge through their training.
That's just because there's a quite interesting couple of things that you mentioned there with regards to the physiology around how that speeds up recovery. When you obviously exercising very hard, you are damaging the tissues that are involved in that activity, whether that's heart, lungs, capillary system, whether it's muscular system. There's micro damages happening all the time, and those are the things that presumably you're referring to in terms of speeding up getting those cells and those tissues back to optimal health in order to be able to train again.
Yeah, very true. So you touched base a couple of things. So recovery entails the muscles being, fresh with no lactic acid. That you can, if you have a training today for 3 hours, and tomorrow for another 3 hours, and the next day. So basically, you need to have a very fast recovery in between those things. So a good sleep, good diet, and also hyperbaric medicine will provide you with that extra oxygen. It will work on the cellular level. So the oxygen you take, you use it in a better way because your mitochondria is higher functionality. Okay, so it knows how to produce more ATP based on the oxygen you have. So that's one thing. If you are inflamed, which you are when you're training high velocity, then we need to reduce that inflammation to a normal kind of good area. The more you're training, the more you put exertion on the muscles, the likelihood of you having a bit more inflammation is greater. So that oxygen is basically reducing that amount of circulating inflammation. So there's a couple of elements into this. There's a couple of kind of physiological elements to this treatment. And this is a healthy human being. Yeah, I'm talking about someone that is training, competing. And we know for a fact that a lot of elite, very elite, not even national level, but elite level, use hyperbaric medicine on a daily basis. So LeBron James he's got one at home, for example. There's videos of him going inside one once in a while. So we know they use it on a daily basis. The knowledge is just not within us human beings, regular human beings, not someone that is working for that level. And that's just the healthy people. We are talking about someone that is injured, and we want to recover. The recovery element is them being injured, either their knee, shoulder, they had a concussion, if we're going to rugby or full contact sports. So we want to put them in a very good position to recover very fast in a better way rather than just faffing around. Obviously, they can go to a physio, they can go to an osteopath, they will visit their GP. But if we are stuck into that chronic phase, so they have a chronic phase with their concussion, they are unable to shake off the pain from that lower back, those chronic kind of conditions will benefit from the hyperbaric medicine because that's exactly the recovery element that they need. And that will be assessed in our kind of preclinical assessment that we do with every patient that comes in. So we'll have a conversation. What's going on? Are you a healthy individual that wants to push their recovery forward? They want to get an edge through your competition. That's one thing. And the second thing would be, Are you injured? What's the injury? What it entails? And how long you've been suffering for it. Some people have concussion syndrome for years after that first or second or third concussion they had. They have memory issues, foggy head, depression, anxiety, whatever. The longer it takes, it makes it very, very chronic. So we need to kind of assess where you're at and what we can do for you. The recovery aspect of our program puts you in a position to get better, brain-wise, emotionally-wise, depending on the manifestation.
And in terms of the effectiveness or the efficacy of the treatments you're giving, is there a value to catching those things earlier on, rather than leaving them to over a period of time?
Yeah, that's a very good question for two reasons. One is when is best to kind of tackle the situation. There's an argument among the clinical and the clinical treatment of it and clinicians that do work with hyperbaric medicine saying the first phase, the acute phase, is where the body heals itself. We don't want to interrupt this phase. We don't want to there's all sorts of cascades that running. Inflammation is good for us in the beginning. We want to have an immune system reaction to those things. So the acute phase is usually not a good time for you to go into the hyperbaric medicine. In the chronic phase, so once you finish the acute phase, you're supposed to be healed, right? So you had a concussion within a couple of days, weeks, you should be out of it. With the right physiology, you get taken physiotherapist, a vestibular, vision, whatever you needed. Someone will treat you at the beginning, and then you'll come out of it. Once you become more chronic, that's a question for us to ask what's going on. Why is the rehab program didn't work for you? Why do you still have memory issues? Why do you have headaches? Then we kind of put you inside the chamber and see and kind of assess that as you go along. Most studies nowadays take the chronic phase. They don't take the acute phase. There was a study published a couple of years, I think 2 or 3 years ago, about stroke. And that argument was there. Should we take the stroke patients early on, 30 to 90 days, which is most of the healing is happening in the first month. After that, we have a bit more healing up to 3 months. Above the 3 months period, there's not much healing. Nothing really happens. The question is, do we want to have them in the acute phase, 30 days? Actually, they found that it's not the right phase to take. Brain works on itself. There's a healing process coming on. We should avoid let the body do itself. After the 90 days, it no longer has any changes, but the memory or other options are dysfunctional, then you are a candidate for hyperbaric medicine.
It's fascinating stuff, isn't it? So sometimes when the injury potentially overloads the body's natural ability to be able to regain that function fully, then at that stage, hyperbaric treatments, that's where they really come into their own.
True.
Okay.
And we know the numbers nowadays. There's like statistics on healthy and non-healthy and stroke and concussion. We know for a fact that 10 to 30% of the people that had concussion, for example, will suffer from a chronic phase. Of those people, they will have a more kind of prolonged. So 30% of everyone, and out of those 30%, 10 to 30% will have a very prolonged, so months to years of those conditions. And that will be from the cognitive aspects of things, so memory, function, attention, all of those things, but they will also have maybe depression or anxiety, some functional, some motorical issues will happen there. And they are really good candidates to come in, be reassessed, and understand what's going on, and then put in the chamber.
So is this a part of another service you offer, which is the Think?
Yeah. So the
that's
second
part of that is the cognitive.
Yeah.
Side.
So the second program that we have is called Think, and basically it's tackling everything that is neurocognitive. It can fall into 2 brackets, by the way. It could be anything from brain injury. So you fell, you've been tackled in rugby, you've been an MMA fighter, you got a kick in the head. That's one. The second one is long COVID that we've been seeing more and more patients with those kind of things that usually the age between 30 to 40, 50, quite young individuals that have memory issues for no reason. They had COVID, nothing major, probably flu-ish symptoms. Then for months and weeks, they have memory loss, a foggy head, a bit more anxious, maybe some tummy, so a digestion issue. There are all sorts of things that don't fall in line with any disease that we know for now. So they fall into that bracket of cognitive aspect of things. So we would like to assess them. And when I say assess, all the programs we offer have a very, very broad battery of tests. We are proud of ourselves that we have the largest, broadest battery of tests. So we'll do a blood test. We'll check their neurocognitive abilities. We are signed up with a company called Neurotrax, which is a huge company globally being used by studies, validated. It's an hour cognitive test you do online. And then once you finish it, we have a huge amount of data on you. So the clinician and the patient will get a report how they did. That's the baseline. Once they've done the hyperbaric medicine, so 15 sessions with us, we'll test it again. So everything that's being tested in the beginning will be retested at the end. So we have solid numbers of where you're at and where you are in the end of the program. That is including also questionnaires, and if you are in the last program we have, is also VO2 max testing. We'll see your lung capacity, your energy, all of those things being done by a very, very good physiologist that we work with. Again, once you've done it as baseline, we'll do it again in the end. So we'll have kind of comparable numbers.
And as we did for the recovery aspect of the hyperbaric treatment, when it comes to cognitive, is that same mechanism happening, but it's happening in the brain?
Yes, but we haven't touched with one element which is crucial. One of the most interesting studies that came about, I think 2 or 3 years ago, was about a concept called hyperoxic-hypoxic paradox. And what that is, it's very complicated, but actually it's very simple. Once the brain sends hypoxia, so the lack of oxygen, it's one of the strongest inducers we have in our body. Once the brain thinks, oh, something's going on, don't have enough oxygen, there's an array of things happening in your body. All of them are supposed to protect you in a good way. And obviously we don't want to strangle our patients. So we need to mimic that hypoxic situation. That hypoxic situation leads to something called HIF. It's a compound that was found and in 2019 was won Nobel Prize. So it's a hypoxic inducible factor. And that factor, what it does, it work on the epigenetics of things, create a cascade of things that are supposed to generate new blood vessels, protect your nervous system, protect your brain. And it's an absolutely amazing situation. But how can we mimic this? So we'll put you inside the chamber. We'll give you that mask to breathe 100% oxygen, okay? And the brain thinks, this is the new reality for me. 100% oxygen is where we at. And then we'll tell you to take off the mask. That puts the brain in a very odd situation because then it's 21% oxygen because that's room air, right? And the brain thinks something's going on. You don't have enough oxygen. And they initiate this cascade of hyperoxic, hypoxic paradox. He thinks that he's lacking oxygen, but actually he's breathing regular room air oxygen. So those breaks, those 5 minutes air breaks, puts the brain in that position that he thinks that he's hypoxic, keeps sending those things into your bloodstream, so stem cell and HIF, and all of those amazing things to repair starts to happen. And that's exactly what we want to do with your brain. If it's any area that is a bit ischemic or metabolically dysfunctional, then we want to send all of those good guys to repair that area.
So it's the relative drop in oxygen levels that is perceived as an absolute drop, which if it was going from 21% normal room oxygen to 0, you'd be in trouble very quickly.
Yeah. So we don't going to put you in a vacuum. That would not work. But the fact is, the 100% to 21 just creates a huge difference to the brain. He thinks, and we can do it endlessly, by the way, because it's a very ancient mechanical thing we have in ourselves. The brain thinks we are hypoxic, we don't have oxygen, let's start repair things. Things needs to be changed now. And we do that every half an hour, 20 minutes while you're inside the chamber. That's the only action you're supposed to do in the chamber, basically. I'll come to
that Netflix.
Yeah, that and Netflix. So focus on the Netflix, enjoy it. But every 25 minutes, half an hour, I'll tell you, hey, take off the mask for 5 minutes, breathe room air, all fine, and then after the 5 minutes gone, put it back on. And that is the hypoxic paradox, and creates amazing change in the brain or any other tissue, by the way. That's the whole concept. That's the think program that we have. So there's more air brakes in the think because we're targeting the brain. And the last program would be breathe. The breathe one is tackling everything that is lung capacity, energy, slightly long COVID, if we know that there's manifestation of breathing aspects. But it works on the same concept, okay, delivering more oxygen to a deprived tissue. It could be the lungs themselves that were suffering from anything from an infection, or you being trying to exercise. So the breathe program is also for healthy individuals that want to increase their ability. And there's a study that was done on masters athletes, so around the age of 40. And they put them in the chamber to test if they can increase their mitochondria function, increase their VO2 max. And they've done, if I'm not mistaken, 40 sessions of hyperbaric medicine, and then they retested them. So they did the VO2 max, they took a biopsy sample of their muscles, and they had a significant improvement in all domains, which is a very fascinating thing. It's a healthy, legal way to get an edge over your competitors, and yet no one is using it. And if only Armstrong knew about this, he might have got away with it. Because we know for a fact that hyperbaric medicine increased EPO. So we know that the capacity of us carrying oxygen in the blood can be increased just by sitting inside the chamber and breathing air. So a very interesting kind of way of looking at competing and getting an edge. So through your diet, through your sleep, coaching, breathing, all of those things will do amazing to you. But if you have a bit of an edge, that's really nice.
Yeah, and as you were talking there as well, it reminded me of, I think sometimes the problem that people have with these emerging technologies and emerging therapeutics or interventions is that we're not familiar with them. But actually, the altitude training taps into a very similar sort of physiological system where it's, if you're going to train, particularly for endurance, is where I've seen most of the research around this, the benefits of having higher blood cell count means you can carry more oxygen to the tissues that you need, and in theory, you can perform better with more red blood cells. So then,
same concept.
Yeah, you go up to altitude.
So the only thing that altitude training, which I highly recommend, is basically working on the opposite. But it still works on the same concept of hyperoxic hypoxic. So you put yourself in an altitude chamber, and the less oxygen you breathe, you trick your brain to think, we don't have oxygen, let's start working. Let's deliver more oxygen through blood cells. So increase EPO, those kind of things. But altitude training is not for everyone, and you need a chamber for that, same as we have. And altitude training is specific for specific things in sports. I don't think you can replicate that into injuries, or I'll be glad to see if that's the case.
Yeah, that's certainly not what I've seen. Yeah. The research I've seen is mainly focused on performance output. But it's interesting because the contra points to some of the benefits of altitude was that, well, actually, when you are in that reduced oxygen level, you can't actually train as intensely as you could when you're breathing normal amounts of oxygen. So does the drop off in your training intensity and your recoverability when you're at altitude actually then compensate for some of the benefits you're receiving from being
true?
So there are, as far as I understand it, there are two sides to that argument.
Yeah. I would say that I'm in favor of, so far the studies that I've read, and I haven't read much, but I've read enough, altitude training is valid. It's being validated. There's a lot of athletes and sports teams that will go into altitudes, especially South America, those kind of places, to increase their EPO, or also to train in a very high altitude. Once they go down to a regular altitude, then they are much more trained for that matter. Especially if you have a training session or a competition in Peru, let's say. So you have to be trained for it. But altitude training is definitely the thing. And I would say, if that's the thing, go for it. Find an altitude chamber and do it. But if there's other things you need to tackle, it's up to us.
But this is, what you're talking about is almost an evolution of the diving treatments. It's an evolution of these ideas that have been seen in the research and then applied in different ways, different levels of success. And this is almost like the next step on that. We're right on the sort of front wave of these treatments. I mean, as you said already, this is accepted in high-level sport.
Yeah.
This is a normal part of a program that you would expect to see, and it's far more established. Whereas in the general population, actually, there's a lot more education needs to happen around these things, and it needs more time, more exposure, more people seeing and hearing stories about people having successfully rehabbed themselves or used these therapies in order for them to then buy into this too. And that sounds like this is kind of where you guys are right now.
Yeah, and I have to say you touch base exactly on the concept. The technology is not new. The concept itself is very old. It's the way we deliver it nowadays. So in the last century, there was a huge leap of like taking it to a clinical level. So we know with the recent studies that how to do it, how the safer way to do it, and now it's our job in the hyperbaric medicine world to kind of spread the word. The same with altitude training and the same with breathing work. There's more awareness nowadays to breathing work, nasal breathing, those kind of things. It's non invasive, it's really simple. It puts you in a position that you are healthier, happier, and that's exactly what we want to do. Spread the word, understand how the technology works, and find those people that really struggle with their condition that they didn't find any solution so far. They might have a solution with hyperbaric medicine. And it's really interesting because I think at one point it will blow, which in a good way, because people understand what we have in our hands. So I'm hoping.
Yeah. Well, also as well, the cost of these things tends to come down over time.
Totally.
I can only imagine that 10 or 15 years ago, the cost of doing this sort of thing would be beyond the reach of even maybe the sports teams. That adopted them tend to adopt them first.
And I have to say that I've done my kind of review of prices around the US, the EU, and the UK, and I have to say that among all of the world, we are not that expensive, considering this is a high tech approach. Having said that, I think that in the future, as technology gets smaller and more widespread, this will be a much cheaper approach to hyperbaric medicine. Having said that, it's really crucial to do the testing before. I think most of the money goes to the testing itself rather than the hyperbaric chamber. The chamber itself is not that expensive. It's the fact that we take you through a journey and we test you from the beginning to end. It puts you in a position that not only you say, oh man, I feel so much better. My memory's better. I don't have foggy head. I can move better. I can breathe better. All of those things. But we put numbers on what you say. So numbers on your memory, numbers on your breathing, your VO2 max, your blood, all of those things will give you, in the end, where you're at. So the battery of tests is the component that takes much of the money out of those things.
So, it's nice to hear because from a training point of view, there's so many different approaches, but when you can provide evidence that somebody's getting stronger, they're losing weight, they're having fewer invasive thoughts during the week, they're feeling less anxious going into situations that they were struggling with, the number of calories they're consuming has come down, the number of phytochemicals has gone up. These data points now, and using wearable technology to back that up, the amount of steps I'm doing, how active I'm being, what's my sleep data look like. This is the way that a lot of the interventions are actually moving, because it enables us to make more informed decisions. It then, I think, also makes it easier for the individual to buy into some of the smaller initial changes that are less perceptible than the larger change once you've finished an entire intervention. If you can see some of these numbers starting to shift, but not necessarily feel changes, you're more inclined to continue to chase those numbers.
Exactly. And I think if you're a patient that come into, it doesn't matter what way, by the way, GP, hyperbaric medicine, PT, physiotherapist, you want to know that, not 100%, but you want to know that you're going to have some progression. And if the progression is measurable, even better, because it puts you in a position that you're more reassured that the process you're going to go through, in the end, you'll see like, oh, I was there, and now I'm in a different position. I eat better, I sleep better, like you said. And I think not guessing, not being subjective, or not being just what I think happened. Like, I feel better. well, better is not really a measurable thing. Let's put you in a place that we know exactly how you feel. We know exactly what's your memory. We know how exactly you go with your um, attention, with how fast you process thoughts. Those kind of things can be measured. And let's see how your bloods are. And let's see how your VO2 max is, how fast you can push yourself. And if we pushed you above 10%, let's say, that's incredible for a non-invasive, very, very, you don't have to do anything basically, just sit down in the chamber. For that kind of treatment modalities puts you in an amazing place. It's really cool.
I can feel the appreciation and appeal of the statement.
Yeah.
It's passive and you don't have to do anything.
Well, I have to say that I've been, and we've been discussing about this slightly, I've been reading Gabor Mate, if you know, he's a brilliant guy, and Andrew Whale, also amazing guy. He's in interactive medicine. Brilliant guy. All of them have the same concept, and I have like quotes on them in different presentations that I give. We don't want to push a patient to be passive. We want to push a patient to take responsibility for himself, be accountable for what they have. And that's part of also the testing we do. We have two experts, one physiologist and one a blood expert. They will give you a consultation through the baseline testing that we give. And we encourage the patient to act on those recommendations. Because the treatment modality that is one, so hyperbaric medicine, has an amazing results. And if we take the whole thing, so holistically, we'll change slightly your diet, we'll change your sleeping pattern, we'll take accountability for your behavior, we might have even more significant improvement. All the studies you've read outside, either it's like brain or lung or sports, they all have one intervention. But none of them are talking about diet or sleep or behavioral stuff. If we add one more, two more to those studies, just imagine how much profound those results would be. And they all say the same thing, those guys that I've mentioned in the beginning. There's no such thing as spontaneous recovery. Because Gabor Mate is talking about, he reviewed patients that had spontaneous kind of recovery from a very severe illness. And he said there's nothing spontaneous about their healing. All of them took responsibility and they're being accountable for their actions. They've changed their diet, they've changed their lifestyle, and they acted on the recommendation they received. And that's what we also aspire to do.
Yeah, I mean that's what I find is so interesting, exciting, because it sits so easily alongside AMP's approach of, it's not just doing these things in isolation simultaneously, but they augment each other.
Exactly.
They actually become larger and have more of an impact than the sum of their individual parts.
Yeah.
It's actually combining these things together where you start to see real, noticeable, manageable change where you can feel the differences.
I couldn't agree more. I think that isolation is never a good idea. And we humans are such complicated creatures. And saying, oh, I'm lacking vitamin C, I should have vitamin C, I should do this. It's a very reductionist approach.
I said that in the morning about coffee.
Yeah.
I'm a very complex human, but I seem to be lacking some coffee this morning.
Exactly. Definitely a thing. Well, I agree with you on the coffee side of things, especially in the morning. But we need to look at things as a complicated situation. This is me coming from Chinese medicine. We never, well, to a certain degree, we never treat the symptom. We go to the root cause. We see like someone will come in, they have headaches or migraines, and we'll ask, okay, how's your sleep? How's your diet? What do? Do you smoke? Do you have a history of this? So we'll look at the bigger picture, and that's what we do also with the hyperbaric medicine. We will encourage you to act on the recommendation you receive. We'll ask questions, we'll give you the answers. Even if we don't have the answers, we'll go and research that for you, depending on what you manifest emotionally, physically, or cognitive-wise. And I think that's how we should approach to every patient, holistically. There's no one element that fits everyone, that's for sure.
I agree. Very well wrapped up.
Yeah.
I'm sure people will be fascinated to find out more. If they would like to know more, or they have anything you talked about has kind of resonated with someone and they recognise that they're in a similar sort of position, how do they find you?
So they can go to the website. It's called Better Never Ends under the tab of services of hyperbaric medicine. We just made a completely new website, so it's very nice and shiny with lots of information and an option to contact me myself. And yeah, it's the easiest way. Just click on it.
Thank you very much.
Thank you very much. I very much enjoyed it today.
All right, I can feel another podcast coming out already.
I would love to. A deeper one.
All right, thank you.
Thanks. Did I stop it?